Hi, my name is Samuel Mojisha, representing Team Streamline. Streamline is a digital platform powered by artificial intelligence that enables communities in Africa to access healthcare and protection from sinking into poverty. We contribute to SDGs, no poverty, and good health and well-being. Meet Sandra. She's a smallholder farmer that grows crops on her garden in Wakiso. She sells the produce at Kalere Market in Kampala. Sandra has 4 children. Jane, one of her daughters, got sick and was admitted at Sebi Hospital for 1 week. To clear the health bills, Sandra had to sell a piece of her garden. As a result, Sandra's business has collapsed and she struggles to survive since. This is the case of 14.2 million Africans that are pushed into poverty due to health expenditures every single year. Globally, 100 million people are pushed into poverty because of health expenditures. About 30% of households in Africa have to borrow money or sell their assets to pay for health care. Insurance penetration is just 1.76%. Insurance remains a product for the rich. So, where is the hope? We have insurance companies, they are very expensive. We have the government insurance, which is promised, marred by bureaucracies, corruption, and no trust from the population. We have NGOs like Save for Health Uganda that are trying, again marred by fraud. And that's where Streamline comes in with a model of community health insurance, aiming at bridging the gap and bringing two core values, affordability and trust. So, how does this work? We look for trusted hospitals that have a good reputation. We connect them to established community groups. The groups must have existed for at least a year. The groups are given a mobile phone application which their group leaders use to save and pay premiums. And then the trusted hospital uses Streamline for community health insurance administration. Streamline does all the administration of the work. And Streamline is powered by artificial intelligence, bringing in forecasting, anomaly detection, etc., to keep costs manageable and to make the scheme successful. All of this brings up a sense of community, trust, and data, which are very, very key to make this scheme work. Well, success story is at Chisizi Hospital, a very wonderful hospital that we have worked with. They were featured in the Economist magazine. The title of the article was How a Ugandan Hospital Delivers Health Insurance Through Barrier Groups. And in the article, they say that the insured are healthier and their finances too. This is an amazing scheme with annual premiums of $5 and co-payments of $1. People can access medications for acute conditions, a normal delivery at only $6, and a cesarean section delivery at $18. Unbelievable, isn't it? And this has worked successfully for 43,000 plus beneficiaries for the last 25 years. So this is a model that we hope to scale up, has been proven, and we hope to help many people access healthcare through this model. So let me go to the technology. How does technology look like? We have a USSD app to ensure that people with feature phones and smartphones can all access the application. The communities use this to register. They can use it in their own language. They save their premiums, pay co-payments, and above all, they can track the status of their insurance, know how it's moving, and all of this, of course, is bringing transparency, which is key to make this scheme work. And then we have the EHealth platform that the hospitals use for scheme administration. This has everything from managing members, insurance groups, heads of families, premiums, and lots of reports, expenditure, which helps hospitals to keep track of this data, which is very, very key to run this scheme. And then we bring in artificial intelligence, one for forecasting. This is very, very key, for instance, to predict the quantities of medicines that you will need. This is key to make sure the hospitals plan well and ensure that the services are available whenever they are needed. And this helps to identify any potential cost saving opportunities and to plan better. The artificial intelligence will also used in class will also be used to uncover patterns. We will apply clustering models to kind of uncover patterns in the data of the hospital. For instance, we could uncover a pattern of a certain village that's presenting with diarrhea cases. We could then get involved in health promotion activities. The hospital would get involved in fixing the water source rather than receiving very many patients with the same condition. So there are lots of patterns, occupations with the diagnosis, lots of patterns that artificial intelligence can uncover and help to keep the costs manageable. And above all, we'll use the artificial intelligence for fraud detection. Very, very key. Fraud is the number one reason why most insurance schemes have not succeeded. In Uganda, in the month of January to September 2019, insurance companies reported 2.9 billion shillings in insurance fraud. So we'll use AI to detect fraud and alert the necessary authorities in time. Yeah, so what's the traction? We have experience. We have 3 years administering the CZ insurance scheme in Uganda. 3 hospitals other than Chisizi have already started offering community insurance powered by Streamline. There are 52,000 patients across all these hospitals that are already benefiting from this scheme. And there is data, 500,000 plus patient records from over 30 hospitals that we are working with that could give us important information for artificial intelligence and for data analysis. We are talking to the Uganda Protestants Medical Bureau, whom we have a partnership with, that want to use Streamline to scale insurance across their different hospitals. The We Rise by Lifting Others organization is working with our partner hospital CZ, and they are keen to support insurance. And we are working also with the Canadian firm Signalytic for hardware, all of whom will help us to build this scheme and make it a success. At the start, we hope to make money from administration fees. We sell the platform to hospitals, and hospitals will pay $100 per month if their scheme is less than 5,000 people, $200 per month for 5,000 to 25,000 people, and the Diamond plan of $300 per month for more than 25,000 people. Hospitals, of course, benefit because they get more customers and build trust in the communities. We hope to uncover other business models. For instance, we'll make commissions since we'll be the ones selling this insurance to the public, commissions for selling. And later, we hope this will grow into a micro insurance company that will provide insurance to very many people across the continent. Our marketing strategy is through medical networks, which connect us to hospitals in their networks, and then to community groups. These could be savings organizations, women groups, Ngozi groups, schools, church, etc. So very, very key for us to market using this network. Mahatma Gandhi said that poor people in isolation cannot achieve anything, but together they can achieve everything. We hope we can work together and together get on the road to universal health coverage. Thank you very much.